Hello and welcome to our webinar all about the NIH Strategic Plan for Disability Health Research. Before we get started with today's presentation, my colleague Maddie Crowley will go over some information about Zoom and accessibility.
Hello, everyone. First, we have simultaneous American Sign Language interpretation available. To view the ASL interpreters, click on the interpretation button that looks like a globe in the Zoom toolbar that's usually at the bottom of your screen. A small menu will appear, and click American Sign Language to view ASL in a pop-out window that you can move around your screen and make as big or as small as you like. Depending on the device you are joining from, you may need to click on the button that says More with 3 dots in the Zoom toolbar. It will open and show more accessibility features. We also have closed captions available. To turn captions on, click the CC button at the bottom of your screen. To ask a question for our panelists today, please use the Q&A function on your screen. It looks like a speech bubble with a question mark in it, and it should be found in your Zoom toolbar. If you have any technical issues or accessibility questions during the webinar, please use the chat to message the hosts. This webinar is being recorded and will be made available afterwards on the Lurie Institute's Instagram and social media, as well as YouTube and website. Thank you so much, and I'll pass it back to Monica.
Thanks, Maddie. Good afternoon, everyone, and welcome. My name is Monica Mitra. I direct the Lurie Institute for Disability Policy at Brandeis University. Before we begin, I'd like to offer a brief visual description. I'm a brown South Asian woman with short hair wearing a maroon jacket. So thank you for joining us for today's webinar, all about the NIH Strategic Plan for Disability Health Research. In March of this year, NIH released its Strategic Plan for Disability Health Research, a landmark document that provides a much-needed roadmap for advancing disability health research across the lifespan. The plan recognizes that disability health research is essential to improving health outcomes and reducing inequities experienced by people with disabilities in the United States. It outlines priorities for expanding the evidence base, as well as strengthening research infrastructure and workforce capacity. Importantly, the plan signals NIH's commitment to elevating disability health research as a critical component of the nation's scientific and public health agenda. So as this strategic plan was released, I know many of us across the disability research community were eager to learn more about its goals, priorities, and implications for future disability health research. So we're therefore especially pleased to have Dr. Adam Politis with us today to provide an overview of the strategic plan and also to discuss its significance for the field. Adam is a Senior Advisor for Disability Health Research at NIH, where he leads the NIH Disability Health Research Program and provides strategic coordination of research activities that promote the health and well-being of disabled people. Throughout his career, Adam has served people with disabilities in clinical, research, and policy roles across healthcare, academia, and government. His commitment to advancing rigorous research and evidence-based policy is informed both by his professional expertise and his lived experience as a disabled person. Following Adam's presentation, he will be joined by my colleague, Dr. Laurin Bixby, research scientist at the Lurie Institute for Disability Policy. Laurin's work examines how structural ableism shapes the experiences of disabled people across systems, including healthcare, long-term services and supports, and carceral systems. Her research, which often utilizes survey and administrative data, seeks to inform policy and systems change that advance disability justice. Laurin also brings her perspective as a disabled scholar and advocate to her work. Following their discussion, we will, of course, open the floor for questions from all of you. Today, I'm really grateful to Adam and Laurin for sharing their expertise with us, and I really want to thank all of you for being part of this important conversation. So with that, it is my pleasure to welcome Adam. Adam, thank you for being here today, and the floor is all yours.
Thank you very much, Monica. And hello, everyone. Before I get started, here's a quick visual description of me. I'm a white man with brown hair and a brown and white beard, wearing a dark gray suit jacket, light blue shirt, blue tie, and dark blue glasses. So I'm extremely grateful for the invitation to speak to you today and provide you with an overview of this inaugural NIH Strategic Plan for Disability Health Research. The plan is really a culmination of efforts beginning several years ago, and we believe it represents an important step forward by NIH to promote the health and well-being of people with disabilities. The plan was released on March 26th, and we're excited to begin its implementation. Next slide, please. So before I discuss the goals and objectives of the plan, I'd like to provide some background on disability health research and the strategic planning process. Next slide, please. As most of you know, more than 1 in 4 people in the United States has a disability. According to the Americans with Disabilities Act of 1990, a person with a disability is defined as someone who has a physical or mental impairment that substantially limits one or more major life activities, has a history of such impairment, or is perceived by others as having such an impairment. Disabilities may be present at birth or acquired at any point across the lifespan and are considered a natural part of the human experience. They may be physical, sensory, cognitive, intellectual, developmental, psychological, or related to chronic illness. Disabilities may be visible, for example, a blind person using a cane, or invisible in the case of a person with multiple sclerosis who experiences fatigue. Disabilities may be temporary or persist for a lifetime. People may have more than one disability, and the nature of their disability or disabilities may change over time. Some individuals and communities may not consider themselves disabled, such as deaf people and many neurodivergent people, but experience discrimination because they are perceived by others to be disabled. The photos on this slide that's taken from our strategic plan were chosen to represent the wide range of disabilities, both visible and invisible, that Americans may experience. Next slide, please. So though we all have experience with disability and maybe believe we understand it as a concept, the reality of disability is quite complex. Disability is a multidimensional construct that may be conceptualized and defined in different ways. Historically, the predominant model of disability in biomedical research and clinical care has been the medical model of disability. The medical model of disability views disability as an individual's impairment or impairments, which must be fixed or cured with medical intervention in order to make a person normal. In contrast, the social model of disability emphasizes that disability is not caused primarily by a person's impairments, but rather by environmental, social, and attitudinal barriers that may prevent people from fully participating in society. Increasingly, disability is understood through interactional models, which posit that disability results from the dynamic interplay between individual medical conditions and biological, behavioral, social culture, and environmental factors. Like all Americans, disabled people may experience a range of medical conditions that affect their health and well-being. They may also face non-medical factors that lead to poorer health outcomes, such as inaccessible healthcare facilities and equipment. Disability health research seeks to understand and address the effects of medical conditions, non-medical factors, and their interaction on the health and well-being of people with disabilities. Disability health research centers the person rather than disability. It emphasizes that disabled people have health needs and goals both related and unrelated to their disabilities, the latter of which have historically been overlooked. Next slide, please. NIH supports a broad range of research related to disability across its institute centers and offices. This research spans the continuum from basic science to clinical, translational, and implementation research. In fiscal year 2024, NIH invested more than $619 million in disability research. This includes investigations into the biological mechanisms underlying physical and mental impairments, medical rehabilitation interventions to improve function and quality of life, and efforts to address disparities in the health and healthcare outcomes experienced by people with disabilities. Disability health research is interdisciplinary and intersects with multiple priorities in NIH, such as aging, mental health, and chronic health conditions. Although many NIH institute centers and offices fund research that focuses on disability-related topics, efforts that typically focus on specific conditions or impairments, rather than addressing people with disabilities as a population with unique health and healthcare needs, with some notable exceptions, like the National Center for Medical Rehabilitation Research at the National Institute on Child Health and Human Development. As understanding of disability has evolved, influenced by interactional models of disability and informed by the experiences of disabled people, there's been growing recognition that NIH needs a more harmonized, coordinated, and person-centered approach to disability health research. This recognition led to two major developments. First, in August 2021, the NIH Advisory Committee to the Director subgroup on individuals with disabilities was established. This subgroup consisted of NIH-funded researchers with expertise in disability health research, including researchers with disabilities. The subgroup issued a seminal report to NIH in December 2022 that emphasized the need for an agency-wide approach to disability health research. Second, in September 2023, the director of the National Institute on Minority Health and Health Disparities, in consultation with the director of the Agency for Healthcare Research and Quality, formally designated people with disabilities as a population with health disparities. This designation helps to encourage research specific to the health issues and unmet health needs of people with disabilities. These developments, together with an increasing scientific evidence base for disability health research and advocacy from disability communities, led the NIH director in spring 2024 to charge the Division of Program Coordination, Planning, and Strategic Initiatives within the NIH Office of the Director, or what we call DPCIPSI for short, with the coordination of disability health research activities. To carry out this charge, DPCIPSI established the Disability Health Research Program, or DHRP, within the DPCIPSI Director's Office in July 2024. In September 2024, the DHRP launched the development process for the strategic plan. The purpose of this plan is to identify agency-wide strategic goals and objectives to advance innovative and responsible research that promotes the health and well-being of people with disabilities. Next slide, please. The DHRP led the development process for the strategic plan in partnership with an internal NIH Disability Health Research Coordinating Committee, or DHRCC for short. The DHRCC representation is broad, including over 60 members representing 24 institutes and centers and 18 offices and programs at NIH. The DHRP and DHRCC prioritize input and feedback from individuals and organizations with experience and expertise in disability throughout the development process. Priorities for the strategic plan were developed by the DHRP and DHRCC, utilizing information and data from multiple sources, including scientific literature and relevant reports, input and feedback from NIH subject matter experts and institute and center directors, analysis of the existing disability research portfolio, dialogues at our community engagement events, which included community roundtables in a town hall and had a total attendance of over 1,000 individuals, responses to our request for information on the strategic plan framework, and input and feedback from our NIH Council of Councils Disability Health Research Working Group, which is a working group of external subject matter experts. Information and data from these sources were synthesized and then used to develop cross-cutting themes, goals, and objectives that address pressing public health needs, support promising scientific opportunities, and promote balance in the NIH research portfolio. Next slide, please. The strategic plan provides a comprehensive and harmonized approach to advancing disability health research activities at NIH. It's organized around 4 strategic goals, each supported by 3 to 4 objectives. 4 cross-cutting themes identify important overarching considerations that intersect with multiple goals and objectives. The goals, objectives, and cross-cutting themes will guide NIH-wide disability health research and are intended to supplement relevant institute, center, and office mission areas. Next slide, please. So now I'll move into discussion of the strategic plan's content, beginning with the plan's cross-cutting themes. Next slide. The themes listed on this slide are key considerations regarding disability and people with disabilities that cut across the goals and objectives of the plan. The first theme is whole person health. Whole person health involves considering the whole person, not just separate organs or body systems, and examining the multiple factors that influence health and disease. This approach emphasizes supporting and empowering individuals, families, communities, and populations to improve health and well-being across interconnected biological, behavioral, social, cultural, and environmental domains. Disabled people have historically been defined primarily by their disability and not viewed as a whole person capable of living a healthy life. Rather than focusing solely on treating specific conditions, whole person health focuses on promoting health and well-being across the lifespan for everyone, including those with disabilities. The next theme is inclusion of people with disabilities in research. Disabled people are often implicitly or explicitly excluded from being participants in biomedical and behavioral research, including clinical trials, without adequate scientific justification. This violates federal regulations and ethical research principles and undermines the generalizability of research findings. NIH must address this issue by promoting the inclusion of people with disabilities in research. Inclusion goes beyond enrollment. It requires researchers to thoughtfully consider the needs, experiences, and perspectives of disabled people when planning, designing, and conducting studies and communicating study results. To be maximally effective, this should be done in partnership with people with disabilities, their families, and their care partners. The next theme is interdisciplinary collaboration. Disability health research spans a wide range of scientific disciplines. Integrating these diverse fields enables a more comprehensive understanding of the complex factors that affect health outcomes for disabled people. Interdisciplinary approaches may also foster innovation in research designs, methods, and interventions that may promote advances outside of the population or populations being studied. And the final cross-cutting theme is technology. Technology can play a transformative role in promoting the health and well-being of people with disabilities. Assistive technology, such as mobility devices, communication aids, sensory enhancements, and accessible digital tools, can significantly reduce barriers to care and participation in society, increase independence, and improve quality of life. Emerging technologies, including artificial intelligence and machine learning, offer exciting opportunities to enhance diagnosis, personalize treatment, and support independent living. However, these technologies also raise important ethical considerations, particularly around accessibility and affordability, privacy and confidentiality, data security, bias in algorithms and datasets, and the potential for misuse or exclusion. To ensure responsible innovation and broad access to these technologies, disabled people must be key contributors and decision makers throughout the technology development lifecycle to ensure that the potential harms unique to people with disabilities are mitigated and benefits are realized. Next slide, please. Now I'll transition to a discussion of the goals of the plan. Due to time constraints, I won't be going through every detail, but happy to provide more detail about specific goals or objectives during the Q&A. Next slide, please. The first goal of the plan is to advance the science of disability health by supporting innovative, rigorous, person-centered research. As I mentioned earlier, disability health research places individuals, not impairments, at the center of scientific inquiry. It recognizes disability as the product of dynamic interactions among medical conditions and biological, behavioral, social, culture, and environmental factors. Advancing the science of disability health depends on supporting innovative, methodologically rigorous research that prioritizes the goals and experiences of disabled people. By fostering this type of research, evidence can be generated that informs policies, practices, and interventions that improve health outcomes for people with disabilities. Next slide, please. The strategic plan's second goal is to foster a highly skilled, multidisciplinary, and sustainable disability health research workforce. Expanding research capacity in disability health research requires creating accessible entry points into the biomedical and behavioral scientific ecosystem for trainees and early career researchers, and providing consistent funding opportunities to sustain careers in disability health research. It also necessitates educating the broader scientific workforce about disability health research so that disabled people may be meaningfully included and benefit from all research, not just research focused on specific disabilities. Next slide, please. The third goal is to support accessible, state-of-the-art disability health research resources and infrastructure. Conducting innovative, rigorous, person-centered disability health research requires modern, well-supported resources and infrastructure that enable the full participation of disabled people as researchers and research participants. Strategic investments in institutional capacity development and collaborative research networks foster a more robust and representative disability health research ecosystem. Enhancing the ethical and standardized collection, analysis, management, and sharing of disability data further strengthens scientific rigor, transparency, reproducibility, and the production of actionable evidence to inform policies and practices that improve the health outcomes for people with disabilities. Next slide, please. And the final goal is to engage in collaborative, responsible and ethical management of disability health research activities. So collaborative, responsible, and ethical conduct is essential for the effective management of these activities. Actively engaging disabled people throughout the entire research process helps ensure that studies reflect community priorities and generate meaningful, applicable findings. Evaluating and refining NIH organizational structures and processes supports efficient use of resources and responsiveness to agency priorities and evolving needs. Maintaining high standards of scientific integrity strengthens accountability, builds trust, and advances high-quality research that benefits with people with disabilities and their communities. Next slide, please. So we believe that the NIH Strategic Plan for Disability Health Research provides a comprehensive framework for advancing innovative and responsible research that promotes the health and well-being of people with disabilities. By adopting a harmonized, coordinated, and person-centered approach, NIH can leverage the distinctive strengths of our institute centers and offices to drive progress on the agency's disability health research priorities. As meaningful engagement is essential to the strategic plan's success, we're committed to building and sustaining strong partnerships with disabled people in their communities. Moving forward, we'll put the strategic plan into action to advance transformative research that addresses the health needs and goals of Americans with disabilities. So what comes next? As I mentioned at the beginning of the presentation, the strategic plan was released on March 26, and we're excited to begin its implementation. The DHRP and DHRCC are partnering to develop and execute our implementation plan for the 5-year strategic plan period. We'll also be engaging with the NIH Council's Disability Health Research Working Group on an ongoing basis to obtain their input and recommendations on priorities for the most needed and promising areas of research, opportunities for NIH-wide disability health research collaborations, strategies for increasing the number of investigators conducting disability health research, and approaches for optimizing outreach to disability communities. Next slide, please. So some of our initial planned activities are listed on the slide. We're prioritizing activities that thoughtfully and meaningfully engage with disability communities, provide training and resources to external and internal stakeholders, foster innovative and impactful disability research projects, and ensure that we measure progress towards the strategic plan's goals and objectives, and communicate regularly and transparency with internal and external stakeholders. So you can see on the slide, we're developing a community engagement plan that will discuss how we'll collaborate, work with community partners, and that will be posted publicly. We're looking at identifying best practices for planning, conducting, communicating, and evaluating disability health research. We'll be creating a highlighted topic, which I can discuss more during the Q&A, that will identify areas of priority for NIH in terms of disability health research and help stimulate research across NIH's institute centers and offices. And then we'll also be launching a challenge or a prize competition, as it's known, that will focus on promoting inclusion of people with disabilities in clinical research. Next slide, please. So finally, I'd like to express my sincere gratitude to all the many individuals and organizations that made the strategic plan possible. It was truly a collaborative effort that I was honored to be a part of. And last slide, please. So with that, I look forward to the discussion and Q&A. Thank you.
Thank you so much, Adam. I know we have lots of questions coming in, so I look forward to our broader discussion. That was a really insightful overview of the disability health research landscape at NIH, as well as the strategic plan. So to start us off, I'll provide a visual description. I'm Laurin Bixby, a white disabled person with brown hair. I'm wearing a blue shirt and white sweater, and I will be moderating our discussion and Q&A today. So just as a reminder, please submit any questions that you have for Adam in the Q&A function in Zoom, and we'll open kind of up to audience discussion a little later on. But first, I wanted to start off and kind of talk a little bit more with you, Adam, about sort of the development and implementation process for the strategic plan. So I know, as you kind of discussed about the kind of historically, much of NIH research has adopted sort of more of a medical model of disability, which sometimes can conflate disability with health or focus on preventing or reducing disability. So it's really exciting to kind of see this shift away from more of a medical model framework for disability health research. So I guess to start off, would you be able to speak more about what motivated NIH to kind of make this shift and develop really this dedicated strategic plan for disability health research at this moment?
Yeah, no, great question. I think, for years in disability communities and among disability researchers, a lot of these ideas were being discussed and advocated for. And, it took time to get to the level of where we could establish, a working group or that sort of thing. But several years ago, like I mentioned, there was really a focus on how do we remove the barriers for researchers with disabilities? And that led to that development of that advisory committee to the director subgroup on individuals with disabilities. That was really a great opportunity. NIH recognized, work needed to be done in this area and provided the forum for it. The co-chairs who led that group realized pretty quickly on that the charge of the group needed to be expanded. So yes, we needed to focus on, removing barriers for any researcher who wants to participate in research. But there were other aspects. There was disability health research. We haven't been discussing health disparities for people with disabilities. We need an Office of Disability Health Research. There was a whole range of topics and things that were discussed. So that really kind of introduced a lot of those topics and areas to the broader NIH community. And that helped develop momentum. And so as that report was released and the subgroup disbanded, those of us inside NIH continued to kind of push this forward. And then the health disparities designation was made by NIMHD. Obviously, that was a very significant development. And that recognition was growing. So those of us who work in the disability field, we know, a lot of things are very straightforward and need to happen, but it takes years or decades to get them to happen. But once you can actually grab people's attention and show them why this is important, you can start to build momentum. And so it really just kind of kept snowballing to the point where we realized, okay, we really need to have an actual plan to focus on this, because NIH is an extremely large institution, very large budget, many different components. How do we actually do this in a coherent way where we can really kind of drive the culture change, but also educate people that we are NIH, we focus on biomedical research. So I'm a person with disabilities. Some of my disabilities I do want cured. Others, that's not the focus for me. I want society to remove the barriers that get in my way. So that's why we really wanted to focus on the definition of being broad, of including all these things in line with kind of current models of disability on the interaction side. And that's really helped us engage a range of NIH internal audiences to get them to understand what we're talking about. When we made the shift to saying, this is about people with disabilities. If you're someone who wants to go into a cancer clinical trial because you have cancer, it doesn't matter if you're a wheelchair user, you should still be enrolled in that trial. And that sort of kind of discussions really led more adoption. And we've gotten a lot of support from the Institute and Center directors and now NIH leadership as well. So, yeah.
Thank you. Yeah, that's really helpful, and to hear a little bit more about the evolution. And I guess I'm curious also, I'd love to talk a bit more. I know one of the kind of mottos of the disability community has been nothing about us without us, and asserting that disabled people must be included in all conversations and decisions and policy discussions that impact our lives. And I'm curious if this principle of nothing about us without us was considered in the development of the strategic plan, and if you can share more about whether, and if so, how the disability community was involved in shaping the plan itself.
Yeah, excellent question. Most definitely, we considered this from day one. So to begin with, our coordinating committee that was responsible for developing this, many of us have disabilities and lived experience. So it was important to us to have really an engaged process throughout. So we did have community engagement events right away. So we had roundtables where we focused on different groups. So researchers, clinicians, people with disabilities, advocacy organizations, to try to get all those different perspectives. And then we had a town hall where we communicated those results. That was formal events. We also had lots of informal reach out. So we really encouraged people that if they wanted to discuss an aspect of this, if they wanted to give input and feedback, they could just schedule a meeting with us, and many people did. So that led us to developing the framework for the plan. And then we put the framework out with a request for information. So another formal way that people can give input and feedback. And we had, between all these different events, we had many, many individuals and many organizations representing, a range of disability conditions, all sorts of things, who gave lots of input and feedback. Now, we had planned to really keep that going, but we did have to have a communications pause at that time. So when the new admission took over, there was a communication pause, so we weren't allowed to have kind of formal external events. But we did still really prioritize talking to individuals and organizations in an informal way. And then we stood up our external working group. So the NIH has a council of councils. It's an external advisory group. We made a working group where we really got wonderful people, including Dr. Mitra, to provide input and feedback on the plan. And then we went through some different iterations, got their feedback, got external feedback, and published the plan. So one thing we highlighted in the plan is that community engagement is a pillar for us. Or if you don't, sometimes I don't like that metaphor because it sets it aside as one thing. We view it as this is weaved throughout every activity we do. So anytime we're considering a new research activity, we want to get how can we get people with disabilities in the various communities involved from the beginning? So the community engagement plan we're working on right now, we're going to be developing with some partners, and that will lay out how we're going to do this, because there's not one way to do it, but I think everyone knows when someone's being honest and truly trying, you might make mistakes. But you're actually truly trying to include the input, and that's what we're really trying to do. So even just to add on to that, like our structure of how we're implementing the plan, we set up subcommittees to focus on areas. We have research, planning, and evaluation to measure the plan. And then our third is literally just community engagement. So it's that important to us.
Yeah, it's, I think, reassuring to hear how important community engagement is to sort of weaving throughout the whole process and kind of as it's implemented. So great to hear. The next question I had, kind of given what you've been describing and how people with disabilities have historically been overlooked or excluded from health research, there seems to be, I think, a lot of endless opportunities and need for future research in this space. But I'm curious, from your perspective, what you see as sort of the most significant gaps in disability health research that NIH hopes to address with the support of this plan.
Yeah, no, great question. And I'll try to keep my answer concise because there's so many things I would want to say here. I mean, I think, we highlighted in the plan, and obviously there's been much discussion about we can't exclude people with disabilities as participants in clinical research. So even just setting aside specific domains of disability health research, we need to be talking about research overall. And if people with disabilities need to be included in a certain trial or certain study, we need to be included for many reasons, because obviously these treatments impact us, but it's also for the scientific rigor of the studies. If we're not including samples of the people who actually be, implementing treatments with, it's not going to generalize. And so that's something that we think is extremely important. Specific areas, there's a lot of areas for research. We kind of organize our objectives around, there's ongoing issues related to data and measurement of disability that, frustrate a lot of us as researchers, but also when we go to try to push forward policies or try to push forward research programs, we get the feedback that, well, you don't have good measures to measure this, so we can't include that. So that's a priority. Obviously, we talked about whole person health and looking at the person and all of the different factors that may impact. So we think, there's great paradigms like the whole person health paradigm we mentioned. That was one of the institutes that NIH has championed and the administration has championed as well. We think taking that tact and just looking at a lot of the studies that have been done are some of them are close. But if we just shift perspective slightly and include the right types of participants and get the right data, we think we can actually really have a lot of benefit there. And we don't think that necessarily requires huge amounts of investments for that specific topic, because we're just enhancing, existing studies. Obviously, health disparities is an important area. So NIHD designated health disparities. Health disparities is still a priority of the NIH director, but it's more focused on solution oriented. So rather than continuing to identify new disparities after new disparity, we really need to get to work to actually develop treatments and interventions that address these. And so that's obviously a priority. And then, we lay out in the plan too that health promotion is a really important one. So people with disabilities are people. We're people. We need to have, health promotion activities that work for us. And so a lot of the health promotion activities aren't designed for folks with different disabilities and don't take that into consideration. And also, secondary conditions is an important topic that doesn't quite have the understanding across all areas of the NIH portfolio that we'd really want to focus on. I'll stop there, but there's many areas. We need longitudinal studies. We need, lots of things I could geek out on, but I'll leave it at that for now.
Yeah, thank you. I really appreciate all of those ideas. And I think it's so important in trying to include people with disabilities as research participants. I know there's often like pretty explicit exclusion criteria that prevent disabled people from participating in research studies, and as well as just significant barriers and lack of accommodations that make research often inaccessible for people with disabilities to participate in, which, as you've kind of touched on, that this exclusion can really have very serious and kind of long-lasting impacts on the health and well-being of people with disabilities. I'm curious if you can just expand a little more on how the strategic plan addresses this issue to really ensure that these barriers are mitigated and that people with disabilities can be full participants.
Yeah, no, happy to expand. I mean, obviously, a strategic plan is general, and really the devil's in the details in what you focus on and how you implement it. What we would like to do is, there's a range of ways to address this issue. There are things like policies that can be developed. Policies take time. Policies, you have to have the window of opportunity to make it happen. But there are also, we can educate the community. So, you could require certain things, and maybe that's what's needed, and maybe we need to move towards that. But in the meantime, while you're trying to do those things, you can really educate the community about, here are best practices, here's what's required by law. And one is just a baseline, and here's how to do that. We're here to help you, we're here to help support. We're not here to impose administrative burden. We really want to actually work together with our researchers, investigators, to do that. So one of the things we're focused on is really trying to identify best practices in this area. So yeah, I mean, like you said, the accessibility of studies, the accessibility of the consent process, looking at eligibility justification, what are researchers doing, and how can we help them consider these sorts of things? How can we have them include disability demographic measures so that they actually understand the sample that they're looking at? So we're going to, I can't talk too specific about it, but we're going to have a challenge related to this, but then we're also going to be looking to develop resources in this area and really try to promote any research that comes in. So nowadays, we're really focusing more so, we always did, but more so on investigator initiated projects. And so if investigators are interested in this area, now that we have the strategic plan, you can submit, and there's obviously, it's shown that it's a priority that we're interested in this. So I think there's a range of ideas. We're always happy to discuss and hear more. But yeah, try and basically, I think with many of these issues, we're taking a kitchen sink approach. Anything and everything that we can do to move the needle, we're going to try. And it's just really a matter of prioritizing with the resources we have.
Absolutely. Thank you. I'm curious, before we open up to discussion, to hear a bit more kind of on that implementation side. And I think one concern that I've heard from some folks in the disability health research community is, like, this is great that we have this strategic plan, but how do we make sure that it's actually supported and funded, and that there's a plan for really kind of carrying out the goals outlined in the strategic plan? So I'm wondering if you can kind of share a bit more about kind of the actual execution or implementation process.
Yeah, happy to. I mean, I think everyone in our committee and program agree that a document's just a document, right? We don't stop there. We are very happy that this got out and reflects the vision and the priorities. But if we don't do anything to follow up with it, a document's worthless. So I will say, within my division, there is strong support for this. Actually, when I briefed the NIH director a long time ago at the beginning of this process, he was extremely supportive and got it right away. So we've had that support throughout, and that's really helped us make sure that it doesn't get stalled at any point. So, there was a lot of change and tumult over the last, year and a half, but we were able to still push it through, and that support continues. I will say, we plan again on posting our community engagement plan, but we'll also be doing annual reports as well that will be public. So we'll list what we did, what we want to do, any data that we have to show these things. So we'll keep everyone apprised the best we can, and we want to be held accountable. I mean, so if you look at an annual report and say that's not enough, schedule a call with us, talk to us about it, and we really would like to hear that. This is a 5-year strategic planning period. So when the end of 5 years is up, we'll look at our progress, and we're going to do the next version of it. So this is not a one-off. This will be continuing. And even our external working group, we plan to have them do a mid-course review halfway through. So they're external folks. They're not NIH employees, and they will be really looking at the plan and our progress and giving us an honest and objective evaluation. So I'll say, the plan does lay out some pretty ambitious goals, and we wanted to make sure that people understood what's needed and where we would like to go, but you have to have resources to implement those goals. So on our side, there are a lot of things we can do with relatively minimal resources. A lot of this is kind of almost like a big culture change project. And so it's on our staff to really go to NIH throughout all the divisions and centers and all the levels to really help people understand this and integrate it into their institute and centers work. So, we'll have a highlighted topic that shows what we're interested in, and institutes and centers will talk about their specific interest in disability health research. But we'll also work with institutes and centers when they're developing their strategic plans and make sure to the best of our ability that we can include concepts and language from the plan in that. That's what we can do on the inside and continue that work and just continue to discuss it. But obviously, you all in the external community, you can advocate for priorities, funding, all those sorts of things. So if you feel this is important and you feel you know what it needs to succeed, please, let your voice be heard. Science needs to understand what the people think is important, and that's how we get certain priorities that make it to Congress and then make it to NIH that we implement. So you all have a big role here.
It's my last question, and then we can start broadening things out. But I'm curious if you have anything you wanted to add in terms of what would you hope will be the most important impacts of the strategic plan, I guess, let's say over the next 5 years?
It's a great question. Yeah, my wish list. I think, and this is in no particular order, but I do think, as I kind of conceptualize as a culture change initiative, if in 5 years internally to NIH, this is well known and we've really got it embedded in every institute and center so that this is a consideration when people develop, notices of funding opportunities, when they're developing their strategic plans, when they're holding seminars, when they're doing outreach. That would be a great outcome for me, that we've really helped integrate it across NIH. And then kind of parallel, that we have done sufficient community engagement and outreach, and our partners have taken it so that we can educate the broader community so that they understand, so that it's not just a relatively niche thing. We want this to be front and center when people are considering how to do biomedical behavioral research. I also think we want to build out some of the research that's either not being done or not being funded adequately. So as many of you know, institutes and centers have mission areas that are very specific. And so if you want to get funded, you have to fit within that mission area. But if you want to target multiple people with different types of disabilities or disability more broadly, there hasn't really been a natural fit for that. So if in 5 years we can get it to where if it's a good project, no matter if it fits a specific mission area or not, we've worked with ICs or we've developed kind of across IC partnerships where we can fund that research, I think that would be really, really helpful. I think as we've talked about a couple of times, the not excluding folks with disabilities from clinical research, I think that's one of the biggest impacts we can make. Imagine if every study you took demographic data on people with disabilities like you did other demographic data, and so you knew what your sample was. That made you think about the accessibility of your studies, and then we could look at that data later on, and there would be fewer barriers to entry. I think that would be an accomplishment on par with the health disparities designation, some of these other things. So 5 years is a long time, but it's also a short time when you're talking about long-term change. And NIH is a big agency that sometimes it takes a long time to steer. But we've really had a lot of support and energy from our leadership, and then from the individual program officers and other folks who are engaged. So I think we can get there, but I don't think we can get there without you all. I don't think we got here without all of you. So it's really the engagement from the community. It's the identifying the issues, advocating for it, that we can then prioritize that, make progress, get feedback from you all, and just keep pushing forward. So as much as I don't want my job to be very stressful, if it's you all reaching out and yelling at me, telling us that we're not doing enough and doing it wrong and we need to do it better, I welcome that. So yeah. So hopefully at the end of 5 years, we look back and everyone is happy with the progress we've made, but the progress enables us to see where next we can go, and we get excited to do that.
Yeah, thank you so much. I think that's really just grateful to see kind of this commitment to advancing responsible disability health research, and I'm eager to see kind of how these goals of the strategic plan are going to be implemented over time. But I would love to kind of open up to some more community questions and feedback. And if folks, as a reminder, I know we have a lot of questions that have been coming in, but if you want to continue adding questions into the Q&A function, and I think if you also have kind of areas you've found confusing or have feedback on the plan, I think that would be also of interest here.
Yeah,
But
very much so. Sometimes we can be in our bubble. And so, yeah, if there's feedback you all have or parts that need clarifying, yeah, please let me know.
So we're going to try to combine some of the questions that are similar, just so we can cover as much ground as we can in our last few, I guess, 10 to 15 minutes of our presentation. But first, I wanted to kind of address some of the questions coming in about community engagement. So first off, how are you ensuring that the outreach is truly broad? How are you making sure this reaches everyday disabled folks?
Yeah, that's a great question. So it's something that from the beginning, we really wanted to be mindful of, that yes, we can include certain organizations that represent disabled folks and they might have a broad reach, but that's not reaching everyone. And so from early on, we talked about, okay, we hold Zoom webinars, for example. That works for a range of audiences, but not others. And so we need to think about different types of activities. So we have developed quite a long list of folks who have been interested. So they either participated in our roundtables or expressed interest or met with us informally along the way. So we have a very large email list that includes, national organizations all the way down to individual folks who they're disabled and they're interested and want to be kept apprised. So that's one way we really encourage people to just reach out to us, and we're happy to have discussions, but then also keep them informed. I will say we do, when we sit down to consider who we're talking to, we have a range of expertise and knowledge areas and disabilities ourselves, and we try to scope out that, but we also want to partner with groups who can show us, where the holes are. And so part of our community engagement plan is, it's not just us developing a plan and we throw it out there and this is what we're going to do and we're going to tell you how it is. We want to develop that with folks. We want to get feedback on it. We want it to be a living document so that we are doing exactly that. We need to know all angles of this. And I'm one who has really appreciated throughout my career that you have to get input and feedback from everyone involved, from every level, from every sector, because everybody has a different perspective. And for those of you who are disabled, you met one disabled person, We all have different life experiences and, different aspects to ourselves that interact in unique ways. And we really need to try to broach that. So it goes back to, again, having to prioritize. So we're trying to cast as wide a net as possible and then continually look at, are there gaps? Are we missing people? And we really want to rely on you all as well. We'll do our best efforts. But if we're missing groups or individuals or topics, just let us know. Just call it out.
Yeah, thank you. I guess in terms of including everyone, there's a question about your plans to connect with community organizations, including Centers for Independent Living, and how can people sort of connect research and SIL initiatives to have change that our community can realize more readily? And if that.
Yeah, it's a great question. One thing I haven't mentioned yet is we have federal partners who obviously do great work in a range of areas of disability. And so we've already had some conversations, but we really plan to partner with folks, in ACL and NIDLR and other agencies who already have existing connections, already have either research programs or services and such to see where we can fit in. So NIH is a large agency, but we have a very focused mission area. How can we work with other agencies who do a lot of great disability work that's much broader than what we do and connect there? So yeah, definitely on our radar that we're want to have those discussions and see how we can fit in. And I will say there is an interagency committee on disability research that has representation from many different agencies. And so we're a part of that and look forward to working with our partners to see how we can best identify these opportunities. Because a lot of times, as you all know, things can be very siloed in the government. And if we just had a little bit of collaboration, we could really do great things.
Absolutely. Thank you. Another question are what the expectations are for including advisory boards or disabled experts in this work.
That's an excellent question. So we have our external working group, which is more of kind of scientific experts. We cannot have an advisory board yet because there's a basically law regarding how you can have advisory councils and boards and how they have to be set up, and there's no mechanism for us to do that yet. We do plan on partnering, with investigators who have grants and they have community advisory boards to try to get best practices from them. Are there areas that, our program in Poughkeepsie can co-fund? But it's something that's definitely on our mind. So even if we can't hold kind of a formal advisory board due to different regulations and such, we want to make sure our engagement events, everyone knows how they can contribute that input. And we hold them regularly so people know when and where they can contribute. And we show them how we take their input in terms of the documents or deliverables we produce. Yeah. We would love to still have the advisory committee to the director, subgroup on individuals with disabilities, but that was sunset years ago. But, we're looking at all options to what we can advocate for moving forward.
Great. I think there are a lot of questions also coming in sort of about training and education, particularly in kind of medical or clinical settings as well. And there's questions about how do we train more traditional clinical investigators to widen their perspectives about things like the social model of disability and improve their research validity.
Yeah, it's an excellent point. It's something we did highlight that we really want to make people aware of these topics and ideas, not just like we said in the presentation for a specific area of disability research, but anybody doing biomedical research. There's a range of things that they should know and should employ and institute in their research. So part of it is, again, it's like a all hands on deck, everything above approach. We want to make sure we have events, webinar series, either that we hold ourselves or we partner with other researchers and organizations to highlight these topics. We want to encourage people to publish in journals, and we may publish them ourselves to highlight these topics. We want to hold challenges or funding opportunities that really highlight this and help push this forward. But again, when you think about how broad the scientific community is, it just will take time. And so we're always looking at what are some of the ways that we can kind of help catalyze this, maybe move it faster than it would have before, because we don't want to wait 2 decades for people to understand this. But, there's a range of things that people talk about, even things like IRBs, institutional review boards. Like if they have greater knowledge of these sorts of things, that impacts all studies done by an institution or journals. We have to think about the whole scientific ecosystem and what every partner can do. So there are things we can do on our side and we can highlight with other partners in the ecosystem, but it's really kind of up to all of us.
Yeah, thank you. So to segue in a bit to talk more about funding, I think there are several questions about the funding landscape. So one of our questions is, how will this impact available grants for researchers external to the NIH? Will there be more funding for this disability health research?
Yeah, so one way to look at it is if there's an institute or center strategic plan that's specific to them and they have, a budget, some have budgets in the billions that they can devote to this. This is an NIH-wide strategic plan on a topic. So you could view it as on the bad side, our program is helping coordinate this, we don't have 100 million to devote to this. But really the reality is this is research for all of NIH. So when we put out, for example, like here's our priorities in that area, investigators can apply to any institute or center where it's pertinent. And when you're applying, say, hey, this is a priority of the entire agency. The ICs will know that, and that will help in terms of showing that this really is something that needs to be funded. We hope to get additional resources in the future. It's always wonderful, but we plan on partnering with our institute and center partners to really identify areas of research that they could devote resources to that we could help them coordinate and understand why other institutes are also interested and kind of be conveners and partners and bring that together. So I'm sure not the answer lots of people would want. We would have loved to come out of the gate with 100 million for this and 100 million for that. It's just not the nature of this, and especially the time we're in. But we do think in the next few years, there's a lot that can be done to highlight this so that existing opportunities get the focus that they deserve and should have had for many years.
Thank you. I think we have time for a couple more questions. We've gotten some kind of talking about language when pursuing funding opportunities, and questions about, does this mean that research is now going to be able to use the phrase health disparities and still get funding?
Great question. Some of these questions are above my pay grade, but I will say what I know to be true, which is our strategic plan, one of the objectives is focused on health disparities, and this is in line with NIH director's priorities that focus on solution-oriented disability health disparities research. So that is what we are supportive of. I will say too that there is an updated definition of health disparities that was developed as part of this. So, the leaders in this area are NMHD, and they have a definition on their website that's current. So I understand what's out there and what's going on and some of the concerns and such. Sometimes there are pieces that are working well, but are portrayed in a certain way they're not working well. Then there are other things. But for us, we have been told that we can pursue this and we can highlight this. And so that continues to be the case for us. And just so everyone knows, these are priorities that our committee and all the folks involved really value. And so these are things we're going to continue to focus on because, the agency's priority is to improve the health of all Americans. You can't do that without improving the health of this large segment of the population, those people with disabilities.
Absolutely. Yeah, thank you. I appreciate you speaking on that. And I think for our last question, people really want to know more about the structure of research, kind of following the strategic plan. So will this strategic plan lead to more cross-disability research work that is not just a disability type only? Will there be more ICs to collaborate for multidisability research? I know the structure of NIH institutes can be a bit siloed or specific to organ systems or conditions. So if you could talk more about this cross-disability research.
Yeah, that is most definitely a focus and a priority for us. Similar to some of my answers earlier, it's really about us helping be a convener, bring the different institutes together. Our research coordinating committee has representatives from all the institutes, so they're talking to their staff and their leadership. I will say just basically, again, the proof will be in the pudding. So we're working on it and just keep on us. And if you feel like we're not making sufficient progress in the area, let us know. But it is most definitely a priority. This is what we view one of the main goals of what we're doing is bring the resources of NIH to address this problem. And in order to do that, we need to work across institutes and centers. And there's ways, long-term ways that will take time and resources to get there, but then there's short-term ways in terms of just providing that education and changing maybe the lens that sometimes people look through at the research. Like I said, we focus on the people, not the disabilities. That changes a lot when we have those conversations. So we've had many conversations with, folks, program officials, all the way up to institute directors, that as we discuss it and kind of present this perspective that, many of us know on the call that they haven't considered that way, it really helps change, and they're open to kind of seeing it that way and collaborating across institutes and centers. So sorry, I don't have more details at this point, but as we share kind of our programs we're implementing and activities we're doing, you will see aspects of it in there. But then again, just keep on us in our yearly annual progress reports. Let us know if you feel like it's not being focused on enough, progress is too slow.
Yeah, thank you so much. I guess it looks like we are at time now. I just want to thank Adam for taking the time to talk with us all today about the NIH Strategic Plan for Disability Health Research. And I want to thank all of you for attending our webinar. When you leave the webinar, you'll see a link to our post-webinar feedback survey that we'd really appreciate if you could fill out. This is really helpful for us to improve future webinars. And also, we encourage you all to please be and keep in touch with the Lurie Institute on social media, as well as we have a newsletter that is sent out over email that you can sign up for. And I believe Amy has put the link for that in the chat. Thank you again for joining, and we hope you have a great rest of your day.